1 in 10 Indians suffer from thyroid issues, most of the time with hypothyroidism. That's 120 million Indians, and women are much more likely than men are developed thyroid issues. So if you are a young girl watching this, it's your duty to know everything there is to know about hypothyroidism. It might affect you or your relatives at some point of time in your life. Hypothyroidism. Hypo means less and thyroidism means anything related to your thyroid gland. A gland present in your neck and responsible for producing two key hormones T3 and T4. T3 and T4 regulate your metabolism. Anything that going wrong with your thyroid gland has a carryover to your metabolism, and your metabolism determines the speed which your body going to work, and it determines your body's temperature and how fast you can use energy from food, and your heartbeat also. Most importantly, how can you burn your calories, and it has one-to-one relation with your overall fitness levels, and that's why hypothyroidism is a fitness issue in many cases, because a lack of thyroid hormones can lead to a slower metabolism, which is a long term leads to a weight gain, and once you gain a weight, it slows down your metabolism rate, and even more it causes many long term issues. So lot of middle-aged women in their 40s and 50s will gain lot of weight suddenly, and they struggle to lose a weight, and it's actually a hormonal issues, nothing to do with their food habits, and most of the time hypothyroidism goes undetected, and that's why it's a big issue. Hypothyroidism and slower metabolism rate can lead to a weight gain or struggle with the losing weight or depression, changes in your moods and changes in your menstrual cycles, and a bunch of long-term issues as well. Long-term outcomes include heart disease, infertility, and serious joint pain and obesity, but those are long-term outcomes. As I always said, any kind of lifestyle disease like a thyroid can be cured by fixing your diet and by fixing your exercise regime. But the point we noted here is that hypothyroidism is one of those rare lifestyle diseases that are of two types, one which can be fixed by fixing your fitness and diet, but the other cannot be fixed. So let's get into a science of it. Now both the cases of hypothyroidism have a similar symptoms. If you are seeing that you are gaining weight suddenly as you are struggling to lose a weight, or if you have a swelling in your neck, it's time to get yourself tested for these hypothyroidism issues. Then you need to think of what kind of the hypothyroidism it is. The first kind of hypothyroidism is most common case, and it can be cured by fixing just through your diet plans. It happens because of a deficiency of iodine and deficiency of iron in your diet. In order to fix these iodine deficiency, you need to include iodine rich foods. So that's primarily seafood, seaweed if you are a non-vegetarian, and if you are a vegetarian, you can go for iodized salt. And as of for the iron rich foods, if you are a non-vegetarian, include a little bit of meat once a week in your diet. If you are a vegetarian, you can go for beans and dry fruits. So iodine can help with the production of T3 and T4. But there is a third factor called goitrogens, and the goitrogens are the food that affect the production of those two thyroid hormones in your thyroid gland, and these are the foods that you want to avoid. This is the list of commonly found goitrogens food items that you need to avoid. In India, common ones are cabbage, cauliflower, mustard greens, and the broccoli. You should avoid these two as soon as possible. Now these are the diet factors you need to change if you are someone dealing with hypothyroidism. Eventually I will be putting out a detailed diet plan to help you to do the same. But let's come into the second kind of hypothyroidism. In this case, you cannot fix it with just by fixing your diet and your fitness. I am of the opinion that it is possible. You shouldn't be putting medication inside your body, and all kind of lifestyle diseases can be fixed just by fixing your diet and exercise plan. But this is one of those rare instances where you need to turn medicines and doctors. The second kind of hypothyroidism involves your body producing antibodies against your thyroid gland. So this is a genetic issue. it runs throughout the family. If your mom suffers from this kind of issues in the past, and it's more likely that you might also get as well. In this situation, your body produces substances actually go and attack your thyroid gland, and it prevents it from producing those T3 and T4 hormones. In the process, you end up with hypothyroidism, and your metabolism rate slow downs, and you'll get those bad outcomes of having a hypothyroidism. So the solution to this problem is that firstly go see your doctor, and doctor is going to prescribe a man-made form of a T3 hormone to you, so that it is a synthetic drug, you can take it to cure your thyroid problems. If you back it up with correct diet plan and exercise, you can cure your hypothyroidism. Now coming to exercise, that's always a main solution in a long-term problems like this. Remember, if you have a habit of exercising regularly, it's very likely that you won't end up with the hormonal issues like this. When you are old, that's what exercise can do for you. Obviously, it can help you burn for fat more fastly. Eventually it will increases your metabolism, and you always have a fast metabolism if you are dealing with the thyroid issues. So exercise regime, that's the biggest advice from my side. So you can continue with the exercises. As a human being, your main job is to keep your body active. If you don't move body forward, your body will move backwards. You are someone who has an active lifestyle throughout your life, you won't end up with the thyroid problems later in your life. And even if you are having a thyroid problems currently, you can get rid of them completely by taking up an exercise regime along with a little help from medication, of course. My biggest advice to every single woman who are suffering from thyroid issues is that firstly, again, it's just like all hormonal problems. This is a very common, very normal issue. Get yourself tested and get yourself educated and get yourself fit again. Hey everyone, if you like this video, make sure you gonna give a thumbs up, and see you again in your next video.